Shock is a critical medical condition in which the body's organ and the tissues do not receive enough oxygen and nutrients due to the inadequate blood flow. It is a life-threatening condition that requires medical intervention. Shock can result from various causes, including the severe bleeding, heart failure, infection, or anaphylaxis. There are different types of shock, each with their distinct pathophysiological mechanisms and the clinical presentations. These include the hypovolemic shock, cardiogenic shock, septic shock, neurogenic shock, and the anaphylactic shock. In this article, we will discuss the pathology and the clinical features of this different type of shock. Hypovolemic shock. Hypovolemic shock occurs when there is a significant loss of blood or the fluid volume from the body, resulting into the decreased blood flow and the inadequate tissue perfusion. This can result from various causes, including the trauma, burns, surgery, dehydration, or severe diarrhea. Pathophysiology. The decreased blood volume in the hypovolemic shock leads to the decreased venous return and the cardiac output, resulting in the decreased blood pressure and the tissue perfusion. That triggers a compensatory response that activates the sympathetic nervous system, renin-angiotensin-aldosterone system, which leads to vasoconstriction and fluid retention. Clinical features. The clinical features of hypovolemic shock depend on the severity of the blood loss and the speed of the onset. Initially, the patient may exhibit the tachycardia, hypotension, and cool and clammy skin. As the condition worsens, patient may develop altered mental status, oliguria, and the metabolic acidosis. Cardiogenic shock. Cardiogenic shock occurs when the heart fails to pump enough blood to meet the body's metabolic demands, leading to decreased cardiac output and tissue hypoxia. This can result from various causes, including myocardial infarction, cardiomyopathy, valvular heart disease. Pathophysiology. In cardiogenic shock, the heart's pumping function is impaired, leading to decreased cardiac output and tissue perfusion. This triggers a compensatory response that activates the sympathetic nervous system, renin-angiotensin-aldosterone system, leading to vasoconstriction and fluid retention. Clinical features. The clinical features of cardiogenic shock depend on the severity of the cardiac dysfunction and the speed of the onset. Initially, patient may exhibit tachycardia, hypotension, and cool and the clammy skin. As the condition worsens, patient may develop pulmonary edema, oliguria, and metabolic acidosis. Septic shock. Septic shock occurs when there is a severe infection that leads to an exaggerated inflammatory response, leading to vasodilation and increase in vascular permeability. This can result from the various causes, including bacterial, viral, or fungal infections. Pathophysiology. In septic shock, the immune response triggers the release of cytokines and other inflammatory mediators, which lead to vasodilation, increase in vascular permeability. This results in decreased venous return, cardiac output, leading to the tissue hypoxia. Clinical features. The clinical features of septic shock include fever, tachycardia, hypotension, and warm and flushed skin. Patients may also exhibit altered mental status, oliguria, and the metabolic acidosis. Neurogenic shock. Neurogenic shock occurs when there is a disruption in the autonomic nervous system regulation of the vascular tone, leading to vasodilation. This can result from the various causes, including the spinal cord injury, anesthesia, or the neurological disorders. Pathophysiology. In neurogenic shock, the disruption of the sympathetic nervous system, which leads to the vasodilation,